This is Dr. David Drozek with this week's lifestyle lesson. This is Return to Wellness, Week 11, and our patient is Al Flanagan. We're going to focus on cardiovascular disease. Our objectives are to understand the benefits of lifestyle medicine for treating cardiovascular disease, and for you to recall studies that demonstrate improvement and reversal of cardiovascular disease with lifestyle medicine modalities. Al is a 65-year-old male with a recent acute myocardial infarction. He has a history of a prior MI and probable peripheral artery disease. He has multiple risk factors for cardiovascular disease. What is the leading cause of death in the United States? Of course, it's cardiovascular disease. What are the modifiable risk factors for cardiovascular disease? We can break those down into primary and secondary. These primary risk factors are smoking, sedentary lifestyle, diet high in saturated fat and processed foods, stress, and poor sleep. The secondary modifiable risk factors are influenced by the primary modifiable risk factors. These include overweight and obesity, hypertension, hyperlipidemia, and diabetes. It's important to remember that these secondary modifiable risk factors also have their own modifiable risk factors. What are those shared common risk factors among all of these? It boils down to diet, exercise, stress, sleep, tobacco, and alcohol. As we've pointed out in the past, these chronic lifestyle-related diseases affect about 3/4 of the population if we include overweight in that list. They are 7 of the 10 leading causes of death and account for 90% of our healthcare spending. Here's the short list. This week we're focusing on cardiovascular disease, along with high blood pressure, high cholesterol, overweight and obesity, and diabetes. Lifestyle medicine optimizes these modifiable risk factors to prevent, arrest, and even reverse chronic lifestyle-related diseases. Lifestyle medicine has 6 modalities: a plant-predominant diet, physical activity, stress management, control of those unhealthy substances, meaningful relationships, and restorative sleep. It's been calculated that lifestyle medicine could prevent about 82% of the cardiac deaths and 70% of the strokes. Dean Ornish's study demonstrated the image-proven reversal of coronary artery disease with a plant-based diet, physical activity, and stress management. His lifestyle heart trial actually showed reversal of the diameter of the stenosis of the coronary arteries as compared to the control group where the disease progressed. Dr. Esselstyn from Cleveland Clinic added to that body of knowledge by showing angiographic reversal of heart disease in end-stage heart disease patients, utilizing a plant-based, whole food, low-fat diet. In the process, he also reversed hypertension, type 2 diabetes, overweight, and obesity. A study on percutaneous coronary angioplasty in patients with stable coronary artery disease demonstrated that exercise training resulted in superior event-free survival and exercise capacity at lower cost and reduced rehospitalizations and repeat revascularizations than did coronary angioplasty in these patients. In other studies demonstrated that non-soy legume consumption actually improves arterial function in people with peripheral vascular disease, as well as improving cholesterol. And as we've mentioned before, the EPIC study demonstrated that people who practiced 4 healthy lifestyle factors had 81% less myocardial infarction risk and 50% less stroke risk, as well as 93% less risk of type 2 diabetes. And those 4 healthy lifestyle factors: never smoking, BMI less than 30, 3.5 hours a week of physical activity, and a healthy diet, high in fruits and vegetables and whole grains, and low in meat consumption. With all this knowledge, still less than 3% of Americans live a healthy lifestyle. But it's not too late. People in that middle-aged range that change their lifestyle by adding 5 or more fruits and vegetables a day, exercising at least 20 minutes a day, getting their BMI down, and avoiding alcohol, within 4 years, they had 35% less cardiovascular disease events and a 40% lower death rate. So we want to focus on those modifiable risk factors, using diet, physical activity, controlling those unhealthy substances, having restorative sleep, managing that stress, and nurturing those helpful relationships. With that in mind, what are the modifiable risk factors that Al has? His primary risk factors include tobacco, diet, sedentary lifestyle, caffeine, stress and struggling relationships, and sleep apnea. His secondary modifiable risk factors include an elevated BMI, dyslipidemia, hypertension, and type 2 diabetes. How would you optimize these risk factors? That's what lifestyle medicine is for. And 4 for More is a good place to start. How do we do that? With our 4 for More healthy habits. 0, less than 30, 30 by 5 or 10,000, 5, 2, 1, and almost none. That's 0 tobacco. Work on getting that BMI below 30 and doing that with physical activity, at least 30 minutes a day, 5 days a week, or 10,000 steps using a step counter. And to eat 5, 2, 1, and almost none. That's 5 servings of fruits and vegetables, 2 servings of whole grains, and a cup of legumes, beans, peas, or lentils, every day, minimizing that added salt, sugar, fats, and oils, as well as the processed foods, meat, and high-fat dairy. Remember, 4 for More is just a starting point. You can go well beyond that 5, 2, 1. Are you ready for health?